Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hey everyone, welcome to this week's episode. I am very excited to break down everything you need to know about lasers. I get asked about lasers all of the time in my practice. People are always like, Kristen, which laser is best for this skincare concern? Which laser should I invest in? Which laser is going to help with which concern? So on today's episode, we are breaking it down. I'm going to talk about all of the top laser treatments, what I recommend, what I don't recommend, and what concerns I feel are best treated by each individual laser. So let's get into it. I'm going to start today's episode really breaking down from most invasive to least invasive laser. Kind of think about this like most downtime to least downtime, okay? That's going to be how we break these down. So number one, CO2 laser. What is CO2 laser? CO2 is a ablative laser. So think about taking off that first layer of your skin. It is ablating it off. Now, there are going to be traditional CO2 laser. So as you can see here, Tamra from Housewives, she had a traditional CO2. This was done in a plastic surgeon's office. This is like the most aggressive laser that you can do. You're going to have tons of downtime with this. It's often done when you are under anesthesia because it's painful. People will typically get this procedure on top of facelifts because surgery can't change your skin, okay? This is important. This is why we need lasers. So that is traditional CO2. Now, I personally don't think everybody needs a full-blown traditional CO2 laser unless you have lots of skin damage. If you have tons of sun damage, lots of fine lines, lots of wrinkles, tons of texture issues, then I'm going to recommend that you get a traditional CO2. However, there's something that's kind of right in the middle I really find to be a sweet spot for 99.9% of patients, and that's going to be a CoolPeel. CoolPeel is a minimally invasive CO2 laser. So think about traditional CO2 being like the mega laser, full ablation, tons of downtime. CoolPeel laser is very minimally invasive. So it's doing the same thing as a CO2, but on a less aggressive scale. And if you don't have severe texture changes, you can get some pretty freaking amazing results with this. What I love about a CO2 laser is that it's minimal downtime. So if you get this minimally invasive CO2, CoolPeel, you can have pretty minimal downtime. We can crank up your settings and treat you pretty aggressively, not as aggressive as a traditional CO2, but aggressively enough to where if you have moderate skin damage, you can get this laser done and you will have phenomenal results. Plan for anywhere from 7 to 10 days of downtime if you do the more aggressive form of this laser. But if you're just doing a regular CoolPeel laser, it's only 3 to 5 days of looking like a sunburn. So I think this laser is huge, minimal downtime. Areas that it's going to treat are going to be the face, the neck, the chest. You can treat your hands with this laser. It's pretty freaking amazing. I love to think of a CO2 laser as anything with texture. So if you have any texture issues, if you have fine lines, wrinkles, pores, let's say you're really concerned because you have some acne scarring, this laser is going to be absolutely amazing. It's safe for all skin types, which I love. And that's something that you have to be careful with lasers, is because all of these lasers are amazing when they're in the right hands. It's kind of like filler. If you have right injector, right patient, right product, phenomenal results. Same thing with laser, right patient, right medical provider, and right laser for that particular concern, phenomenal outcomes. So anything texture related, I love a CO2. It also helps with pigment, which is awesome. Now, it's not specifically for pigment. So we'll talk about a specific treatment for pigment. So if you're like looking for something that is specifically for pigment, then I wouldn't recommend this laser. However, if you have pigment issues, but you're also concerned with texture changes, some fine lines, wrinkles, acne scars, some mild skin laxity, I love a CO2. I really love CO2 underneath the eyes. So I will show you guys this transformation. This is as close as you can get to a blepharoplasty, which is a surgical procedure that cuts off the lax skin around in the upper or lower part of your eye to tighten. Now, these results are not going to be surgical like a blepharoplasty, but if you're not quite ready for a blepharoplasty, I 100% recommend this. Results are amazing, and the downtime is going to be 2 weeks. So really not crazy. Again, these lasers are more minimally invasive. So mild skin laxity, any issues around the eyes as far as lid laxity, sagging lids, highly recommend this. Texture changes in your skin and mild pigment concerns, definitely recommend a mild CO2 laser like CoolPeel. Now, what you could plan for is multiple treatments, and that's the only downside to this is traditional CO2, you're one and done. With a CoolPeel laser, you may need a series of 2 to 3 treatments and then maintenance 1 to 2 times a year. But again, for the swap of downtime and the absolutely amazing outcomes you get, I think this is one of my go-to lasers. Next, I'm going to talk about RF microneedling. So RF microneedling is radio frequency microneedling. What that means is radio frequency is basically delivered into the tissues through needles. And these needles are going to drive that energy deep. Now, for skin tightening, this is my go-to. In particular, I love Morpheus. Different RF microneedling types that you'll hear about are going to be Vivace, you'll hear about Virtue. Any RF microneedling device is probably amazing. I personally just love Morpheus, and that's just because I get insane outcomes with it. Now, something to be careful about is you have to go to the right provider, because if you do Morpheus at the wrong depths, like somebody treats you too deep, for your skin type, for your skin tissue, for your skin concerns, you can melt fat inadvertently, meaning you may not want to melt fat in certain areas, and you can actually melt fat with this device. So it's very important that we're treating at appropriate depths and that you're not just looking for the cheapest Morpheus provider out there. You need to go to somebody that really understands what they're doing. On average, I think treating the skin anywhere from 1 to 2 millimeters depth is completely sufficient. You don't need to treat the skin any deeper than that, or you risk melting fat. Now, there are areas, which is why I love Morpheus, that you do want to melt fat. So I definitely want to melt fat in this submental area. This is something that a lot of people have genetic fat underneath their chin, underneath their jawline. So this is a really great treatment. And what's awesome about it is we can customize it for you. So we can treat you superficially, 1 to 2 millimeters, everywhere on your face and your neck except that jawline and submental area. So we can really contour the face and see pretty significant changes with that. Now, another reason I love this is there's not a ton of downtime. So it's about 3 to 5 days of pinpoint bleeding. So you kind of look like you have a bunch of coffee ground stains all over your face. Those will fall off over 3 to 5 days. But with any laser, I tell my patients I recommend 2 weeks before an event just to make sure you're in the clear. So if you have areas that you're like, I want to tighten my skin, radio frequency microneedling is my go-to treatment. It just needs to be done with the right provider so that you don't have bad outcomes. It's also important that you're a good candidate for this procedure. Somebody that has very, very thin skin may not be a great candidate for this and would probably be a better candidate for the CO2 laser that we talked about before. So choose the right provider. But if you think you are a skin tightening candidate, then that is the procedure that I would go for. I would rather do the texture issues with a CO2 laser, but the really great thing with Morpheus is it's going to treat that as well. So because of those needles, the microneedles, you will get some of the same benefits as you do with microneedling. So patients that have pretty severe acne scarring, I will recommend Morpheus because we can treat you at different depths. So that CO2 laser is a little bit limited in that it can only treat the first layer. So oftentimes I find that combining a CO2 laser with a Morpheus, if you have pretty significant acne scarring, is a go-to because it allows us to really break up those scars. And then also it's important if you have acne scars, lasers alone will not fix that. So that's something a lot of people don't understand. They think lasers will be fixing everything, and lasers do amazing things. They absolutely help with skin, with texture, all of these things. But just like fillers, it's not a one size fits all. So if you have acne scars, you may need Morpheus, you may need CO2, and you may need something else like a biostimulator underneath in order to get 100% outcomes. If you guys want me to do a full episode on acne scars, let me know in the comments below, because that would be like an entire episode. I would love to do that for you guys. Let me know. Biggest takeaway with RF microneedling is that if you need skin tightening, this is the treatment that I recommend for you. Now let's talk about a laser that's a little bit more specific. Everybody talks about pigment. Pigment is a main concern and issue for patients, and lasers are my number one gold standard to treat pigment. Now, it's important to understand what type of pigment that we're treating, because if you have pigment that is melasma, so melasma is very different than hyperpigmentation, you need to go to a provider to get assessed and make sure that you don't have melasma. If you have melasma, I do not recommend lasers. Heating up the skin will actually make it worse. So this goes to the right candidate, right provider when it comes to lasers. But if you have areas of pigmentation, so like brown spots on your skin, I love a photofacial. IPL is intense pulse light, and basically that is a laser that is going to target browns and reds on your skin. There's also lasers like Moxi, BBL, which is broadband light. So these wavelengths are just different sizes, but they do pretty much the same thing. They're targeting your pigment. And these lasers I think are absolutely amazing. The only thing I think is limiting to them is that they're only targeting pigment. So if you have other concerns, you're probably going to need a different laser. If you have some pigment issues, but also texture issues, I'd recommend the CoolPeel laser over IPL. But specifically, if you have pigmentation, 100% IPL, BBL, Moxi, these are amazing lasers that I recommend for everyone. Something to keep in mind with these IPL laser treatments is that IPLs are not safe for all skin types. So if you have darker skin tones, you are not going to be a candidate for this particular laser. Make sure you get consulted with an aesthetic provider before choosing to get treated with IPL. Now, I do want to mention a couple other lasers that I don't typically recommend, but they're popular and they're talked about. So I'm going to talk about them. Number one is Fraxel, and Fraxel is like a baby CO2. So this laser is going to be similar to a CO2 that we talked about earlier, except it's not going to completely ablate your skin. It's a non-ablative laser. For me, I don't think this is a bad treatment, but I think there are better results and outcomes with a CO2 laser. So I typically will steer my patients into getting a CO2 rather than a Fraxel, just because you get more bang for your buck. Another treatment that is all the rage right now is Sofwave. And Sofwave uses radio frequency heat to stimulate collagen and tighten the skin. It's a non-invasive version of Morpheus. So Morpheus uses the needles, Sofwave has no needles. Now, there's nothing wrong with this procedure. It uses radio frequency, so it does have collagen stimulating benefits, which will tighten the skin. There will be less downtime than there will be with Morpheus. However, there's just more data and studies around RF microneedling. I've seen better outcomes. So for me personally, I would rather steer my patients towards RF microneedling rather than a radio frequency device that doesn't have microneedles. That's just my opinion, but these are the lasers that I do recommend. I recommend CoolPeel CO2 laser for anybody with texture issues. I love a photofacial. IPL, BBL, Moxi. If you have pigment, 100%, these lasers are worth the investment. And for any issues when it comes to skin tightening, I love RF microneedling, Morpheus in particular. And something that's really great about RF microneedling, you guys, is it's not limited to just the face. I'm obsessed with RF microneedling when it comes to body treatments. I use it for tightening up my stomach post-baby. Amazing results. It helps with cellulite. So it is an amazing treatment that you can get in other places, not just the face. And what's really great about Morpheus in the body is we can actually target fat in these areas as well. So it's like my go-to recommendation. If you've had a baby, you want to tighten up your skin, you have stubborn little fat pockets, I love an RF microneedling. And these are alternatives. So I like to tell my patients, these don't replace surgery. they will make your surgery results better because there's no surgery that fixes the skin. So very important to understand that. I recommend doing these laser treatments in moderation and with the right injector or right medical provider so that you get amazing outcomes. You can do this in conjunction with surgery. You can do it to prep your skin for surgery. All of these things will make your facelifts better in the future. And as far as body treatments go, depending on what you're a candidate for, if you have moderate to severe body fat or skin laxity, you need surgery. Mild to moderate, and you're looking for an improvement, these are amazing body tweakments that will give you pretty amazing outcomes. So hopefully after today's episode, you guys know how to break down the most popular lasers when it comes to texture, CoolPeel, skin tightening, RF microneedling, anything pigment, IPL, BBL, photofacials. I will see you guys next week.